WHBF is local for Davenport and local for you. This is Local 4 News at 5.
Welcome back. There are gaps when it comes to the quality of health care people receive that can be identified along racial lines. Dr. Wanaki Carr is an OBGYN with Genesis Health Group, and she joins us to talk about some of these differences. Thanks so much for being here.
Thank you for having me.
So what disparities do you see in health care along racial lines as a minority yourself even?
Yeah. Well, in my practice as an OBGYN, we have a multitude of women from all walks of life, all different races, ethnicities, and socioeconomic statuses that come to my practice and see my partners. Things that we see are difficulty accessing care. We see difficulty even being able to make it to their appointments due to lack of transportation, don't have bus tokens. There are a variety of things that in my patient population that makes it difficult for minorities and patients of all walks of life to access great care.
You said among men and women?
In my practice, women, but definitely in men as well. It's also a problem across gender lines.
Sure. What about shorter life expectancy and I guess the risk of certain conditions for minorities?
Yes. So we know that black men have a shorter life expectancy compared to white males. We also know that women have the disparities in terms of life expectancy are more equal with black women to white women.
Sure.
But we do know that in pregnancy, the pregnancy morbidity and mortality is significantly increased compared to in black women and compared to white women.
What about certain risk for certain conditions as well, besides, say, life expectancy?
Absolutely. So in women in particular, they are at increased risk and during their pregnancy of having higher risk of pregnancy complications, including high blood pressure, diabetes, conditions such as preeclampsia, preterm labor. Those are all increased in the minority populations.
What do you see in your practice, though, as barriers for those minority women when there is the risk of premature birth and, let's say, other complications?
Yeah, I think in my practice, what I see most often is the inability to seek early care. So we always encourage our patients and all women that when they find that they're pregnant to try to seek out a prenatal care provider as early as possible to help reduce those risks of developing pregnancy complications such as diabetes, preeclampsia, high blood pressure in pregnancy.
So you do notice a higher risk for women giving birth among African Americans. What can be done, I guess, to close these gaps most important?
Yeah, I think as a patient, I think seeking out prenatal care early, building trust and establishing trust with your prenatal provider or your healthcare provider. And I think on the side of providers, I think we need to take it as a responsibility to make sure that we are trying to be as unbiased as possible when we're seeing patients, to understand that there are women who are at increased risk for various complications in their not only their pregnancy but in general.
Dr. Wanaki Carr, thanks so much for your time. Appreciate you being here this evening.
Thank you.
Straight ahead.